Good morning. First of all, I would like to thank Businessworld for giving me this opportunity to be with you this morning. I would like to start my short note with the conviction that India can become the first country in the world to dissociate healthcare from affluence. India can prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. For this to happen, all we need is the right policies. Today, we are cribbing about government not increasing the budgetary allocation. What is important for the country? It is not how many heart surgeries are done or how many patients undergo radiotherapy following cancer. What is important for the country is how do we reduce maternal mortality and infant mortality in the country. Every 10 minutes, a young lady dies during childbirth. Over 3 lakh children die the day they are born. Unless we fix this problem, all your dream of building super specialty hospital will not happen. For this to happen, all we need to do is to have a government policy which simply says, let us equalize UG and PG seats in medical colleges. That's all what is required. Believe me, our maternal mortality rate will come down by more than 50% within 3 to 4 years. Forget about Indian hospital. US hospitals are considered as some of the safest hospitals on the planet. If 200 patients get admitted to an American hospital and they spend one night in a US hospital, 1 in 200 dies due to medical error. It is not medical negligence, it is medical error. Getting admitted to an American hospital is 10 times riskier than skydiving. Why it is so risky? It is because unlike all the other industries where risk is an important issue, like aviation industry, where everything runs on protocol, healthcare industry has protocol but nobody follows. Because these protocols are written down in a nice file which is folded, kept in a folder. How it can change? It can only change if we bring IT to actual practice of delivering healthcare. And today with the mobile platform, it's possible. We started our journey 12 years ago with the satellite from ISRO. We were treating patients in remote locations. We have treated over 53,000 patients in remote locations. 7 years ago, when we started liver transplants on children, surgeons, the anesthetists from Children's Hospital of Philadelphia were anesthetizing a liver transplant patient in our hospital in Bangalore. This is what technology allowed us to do. And we invested on a cloud solution when only thing what people thought cloud was the one which brings the rain. We were the first hospital to invest heavily on cloud. All our patient data, all our ERP, everything was on a cloud 7 years ago. Then we started using technology to educate patients. All over the world, when a patient gets admitted to the hospital, the family members, the spouse can stay with the patient, but they're not allowed to touch the patient legally. But 4 days after the heart surgery, we call the spouse and we give her one plastic bag with all the medicines and we ask her to take care of the husband. She's lost. She doesn't know what to do with him. So we thought, why not we use the spouse to educate her so that she will be able to take care of the husband when she's at home. So they developed audio video based tools to educate the spouse. There are only 12 tasks a spouse is expected to do: checking blood pressure, checking pulse rate, wound dressing, prescribing medications on right time, physiotherapy, and all these basic skills. So we developed these tools as a video. We put it in YouTube, When a patient gets admitted, we download this into their phone so they can learn how to do this. And our nurses tutor them. In the process, readmission to the hospital came down significantly. Now, it's a simple tool. What happened? The British Parliamentary Commission, this is a report from British Parliamentary Commission, 6 months ago, they recognized Care Companion Program as the best patient empowerment tool. Just using the technology, using the common sense, how we can get a very passionate member of the team, that is a spouse, to take care of the wife or a husband. This is what technology does at virtually no cost. Bedsore following heart surgery across the world, the incidence is 8% to 40%. How do you reduce it? You can only reduce it if you get the team involved, the nursing team, in eliminating bedsore. But then, when the bedsore happens, nurses pass on the blame from one department to the other department. Ward nurses will blame the OT nurses blame the ICU nurses, and it goes on. Today, every mobile phone has a camera. So we insist all the pressure points in a patient who can develop a bedsore, they should photograph and keep it in the phone, so they can defend themselves when a bedsore happens. And what is the outcome? In 4 years, incidence of bedsore came down to 0%. Our biggest problem is a regulation revolving around data privacy. And all this happened because of a big US EMR companies. What is the biggest problem? Our greatest fear in technology penetration in India, we are scared that everything which stifled innovation in healthcare in the US will come to India. You will be surprised, a doctor, Vijay is an intensivist in US. He has to deal with 6 gadgets. One is a desktop, one is a computer on a wheel. Because in US, mobile platform is not acceptable for delivering healthcare because of HIPAA compliance issues. 60 to 70% of the doctors still use pagers. Pagers have disappeared in this world. But US hospitals still insist on using pager because they will not allow you to use the mobile phone as a pager. Now, why all this happened? It happened because the industries are so powerful, they will not allow these changes to happen. And today there are 600 EMR companies in US. And these EMRs, to get a EMR for a hospital is almost as expensive as building the hospital. And none of these EMRs talk to each other. So this is the scenario. Our greatest fear is if we do not address these issues of openness in terms of allowing any tool to be used by the patient, as long as patient is comfortable with this consent, our entire growth of technology will be stifled. Because in US today, patient data privacy is more important than the patient life. If a hospital with the patient data loses the iPad or a laptop, the minimum settlement cost for losing the patient data is $12 million. So because of this fear, no hospital allows the patient data to be transferred to any of the gadgets which doesn't belong to the hospital. So there is no question of innovative entrepreneurs trying to develop an app. So why do we see thousands of apps coming about losing weight, protecting your hair, or exercising? Because none of them are into the real healthcare of treating patient when he is in the hospital. Why? The fear of data loss. What's the advantage of having all these gadgets on a cloud? The advantage is we have this iCare ICU platform on a cloud. So when we operate on a patient in Cayman Island in our hospital, when the patient is in ITU at 12 o'clock at night, it is 11 o'clock in the afternoon. So our nurses staying in Bangalore monitor the patient in the Cayman Island ICU because the data is on cloud. So this is how healthcare will get transformed. And same thing will happen when it is night here. doctors in Africa, nurses in Africa may be able to manage our patients. So essentially, we are giving the best deal to the patient by better connectivity. Now, what impact it will have on a day-to-day practice? A diabetic patient, does he need to see a doctor every day or whenever the blood sugar is high? It is not required. We have a young diabetologist called Poonam. She started using WhatsApp on the patient insistence to manage the patient care. So a patient in rural Maharashtra sent the data, and Poonam took the notes on a phone. She wrote it down on a piece of paper, then she took a photo of it in a WhatsApp. Now the data is available to the patient, so there is a file. Then Poonam wanted to know how big the lady is, and next thing she gets is the patient photo. Poonam wanted to know what drugs patient is on, and the patient's son put all the medicines on the table and took a picture. So doctor knows what the medicines are. All this happened. The beauty of taking care remotely is not about remoteness. Poonam is staying at home, taking care of a little kid. She doesn't want to work in the hospital. Like Poonam, we have thousands of young ladies who are diabetologists, pediatricians, dermatologists. All of them can take care of patients at home once there is a proper connectivity. And all it requires is a mobile phone which will have access to the patients wherever they are. Now, all these technologies, if it has to be developed, is it expensive? Is it difficult? It is not. We'll just give an example. When the patient goes home, we need to communicate with the patient. Patients, when they call the doctors don't take the call. So we developed an app called Bol. In Hindi, it's a speak. So this app is available in iPhone and Android phones. We spent hardly a few lakh rupees. The idea is that patient, even if he is uneducated, will be able to communicate with the doctors in the hospital just by voice. And voice is very important in a country like India because our patients are not able to text. And this app is now under trial. Our idea is that patient by 2 touches can send the voice message. Do you know how long it takes if you have to convert a text message from the voice? How long it takes? 1 minute of voice message, if you have to convert into text, do you know how long it takes? It takes 22 minutes. So 1 minute of voice message, if you have to text it, it takes 22 minutes. So if you give them an option of sending a voice, you can easily communicate with the patient. Essentially, there will be a big change which is going to happen, and the big change will be revolving around the IT, but there will be a lot of mistakes. When we depend on IT, learning is difficult. There are many mistakes. 15 years ago, I wasn't comfortable in using the phone other than a green button to take the call and a red button to switch off the phone. But my wife insisted that there are a lot more functions like text messages which I have to learn. So I started learning how to send text messages. And the first message I sent to my wife was, "I love you, honey." And she would respond, "I love you too." And it went on like that. And one day I came home and my wife looked at the phone and she banged the phone and she was very upset. And I wanted to know what happened. And I sent a "I love you" message to the matron of the hospital. So you will make mistakes on and off, but then this is part of life. And I'm extremely grateful to Businessworld for giving me the opportunity. Thank you.